Good evening, good evening, good evening. Welcome to Interesting Talks with Footprints. Hopefully your glass is half full rather than half empty. And as you know, you can top it back up no matter where you are in life. We're in the car today, a new place to do a video. But hey ho, what works, works. Yeah. Today's talk is going to be about cognitive reframing. Cognitive reframing. It's a bit of a follow-on from last week, which we talked about the different styles of therapy and how different therapists work in different scenarios. Cognitive reframing is more attuned to a cognitive behavioral therapist. Cognitive, so you're thinking about your thoughts. And in short, what we're going to learn how to do is reframe how we see certain situations that might have more negative connotations. And we're going to look at it in a different light and try to see it in a more positive and a more wholesome viewpoint. Now, some of these negative thoughts that we might have been having, when whatever circumstances it is, could go back all the way to childhood. So it might be something that we need to reframe that we've happened to us in our childhood. So with some of my clients, if they've got some stuff that I think that's triggers from their childhood, then I get them to look back at their childhood, possibly write a letter to their little self, and validating their little self that they're not responsible for anything that took place in their childhood, because as a child, you're on a learning curve and you've not passed your driving test yet. So you're not responsible for what takes place on the road, for want of a better description, until you're about 14 years of age. So anything that happened in your childhood that is affecting you in your adulthood, sometimes I get people to readdress it. It's also a form of reframing, okay? So it helps with situations to set a different angle by changing the negative thoughts to a more positive one, which we can do. And you can practice this in any situation, anytime, in with your own thoughts. But what you need to do is have your thought and question this thought. Is this thought valid? Is it not valid? Where's this thought coming from? Maybe write it down. It's easier to write stuff down so you can collect your mind and see where your mind's at, and maybe change these thoughts. It's a technique that can improve mental health and make you more resilient over time. So it's really well worth learning, because the resilience over time is something that we're going to have, because the longer we live, the more resilience we need to have to cope with day-to-day issues that crop up. So it's to shift your mindset to be able to look at situations in a personal level, a relationship level, from a slightly different perspective than what you've been thinking at this present time. Yeah. Now, if it's on a personal level, could be something. I'll give you an example. It could be something like, I don't know, let's say Sarah. She lives at home with her mum. She's around 19 years old, to give you some perspective. And her mum is on her case for making her bed, for making sure she has a shower every morning, for having breakfast, for cleaning her room and cleaning the house, doing shopping and ironing. Now, Sarah might come to see somebody like me and she might say, oh, my mum is just on my case, always getting me to do stuff. It's very, very overwhelming for me. And every time she calls me, it sends a shudder down my spine. What is she going to ask for now? Now, I could say to Sarah that maybe your mum is retraining, or training you, should I say, not retraining, training you. So when you leave home, which is going to happen next year, for example, and so you'll be able to be fully efficient in your house. When you move into your new flat, you'll be able to cook, you'll be able to clean, you'll be able to budget and do the shopping, which are really important things for a successful adult to be able to do, to be able to budget and live, clean, cook, take care of all of the domestics as far as they possibly can. And if your mum is training you for that, actually she's helping you. So when she says this, and I think, well, yeah, I've got one more year left, and she's teaching me how to do these things to get it right, so that my life can be productive. It's not that she's just nagging me for nagging's sake. That's reframing it. Might seem like a simple example, but for somebody that's going through something like that, it would be, and they've never thought about it in that way, it would be a lifesaver for them. Trust me on that. Another example would be, you may be going for an exam and you fail the exam, and you say to yourself, well, you know, what's good about that? I failed my exam. There's nothing good going to come out of that for me. Well, if you take the exam again, like next year or 6 months later, the exams are there to be taken again, then at least you've taken out the fear of failure. You know you've failed. This time you've got a higher chance of success rate. You're doing a similar exam, so it's going to be similar questions, and you're going to be well prepared for it, because, you know, you don't want to fail twice. Okay? So you're reframing the situation that turned out negative, and you're putting a positive spin on it because you can put a positive spin on it. And you're not just going to cop out and say, oh, I'm not going to have another exam again, I give up. No, you're going to go back for it again. But the way you go back for it again, which is a positive mindset that you've learned what not to do. So now you know what to do. Another one could be when you go applying for a position, a higher place at work. You could apply for a position and you don't get the promotion. Somebody else gets that promotion. But if you didn't get that promotion, then a therapist could ask you, what are the positives that come out of you not getting that promotion? And you might struggle to answer that at some stage to begin with. But some of the positives might be, one, you would be having you'd be having more stress if you took that job on. Now you're in a position where you have less stress. So that's an advantage. And again, another position may come up, which should be more suitable for you, where you can get that promotion and the stress is less and it more fits into the whole of your lifestyle. Yeah. So this is something else to think about. Another one is that, let's say you got a parking ticket for, not a parking ticket, a ticket for texting whilst phoning, on your phone whilst driving. Now, of course, that's not a great thing. That's a bit of a bummer, I would say. It's going to cost you money. It's going to cost you points on your license. But on the flip side, what have you learned about getting a ticket for whilst texting, whilst driving? You've learned that, one, you shouldn't do it. It's going to cost you money and your license points. But two, the bigger thing is you could have a serious accident and hurt somebody else or hurt yourself. So next time when you're thinking about texting and driving, you won't. So you've turned a negative situation into looking at the positive sides of it. That's reframing in 101. Now, as I've said, you can do this by yourself, but it would definitely be a lot healthier or easier to do it with a therapist. And here are some of the things that reframing is definitely useful for: addiction, anxiety, chronic pain, depression, eating disorders, insomnia, post-traumatic stress disorders, anxiety and stress itself. So it's not a panacea, but I've used it with my clients and clients have found it very, very useful. So you could try this technique on yourself. It's called reframing. You could have a look at it, look it up online, see what you can get out of it. But if you're going to see a therapist and then you not feel that they're helping you enough, mention to them, are they familiar with reframing techniques? And if they are, ask them to help you to guide you through your set of reframing techniques. Hopefully you found this video useful and it's ticked some boxes that you needed to be ticked to give you some information about on reframing or how you can help yourself without even seeing a therapist. Leave comments, tell me what you think of this video, and if you've got any tips of your own, how you do your own reframing, or you've picked up stuff from therapy, how you've been able to reframe, leave them in the comments so other people can learn. Do subscribe, hit the notification bell so when the videos do come out, you're ready to, you're first to watch them. And do take care of yourself and try to stay positive. See you in 2 weeks' time. Bye for now.